what suggestions would you have for someone who's doing their surgical clerkship or a way elective in orthopedics?
Yeah, that's a really good question. So surgery is hard, and it's hard for the residents who are doing it. And so add to the resident's workload a med student who is excited about it, who wants to learn, who wants to be helpful, but doesn't know a thing about being in the OR. And you just end up adding to the stress of that resident rather than actually being helpful. And so one way, if you're really starting to think surgery early on, is spend as much time in the OR as possible and really get an understanding of the workflow of the OR and really get an understanding of, how things work there. One of the fellows when I was a resident once told me, like, it takes 2 years of being in the OR to just like learn how to not be annoying in the OR. Because it's just so easy to get in the way. And as I said, everyone is in kind of, go mode, and no one has that much extra time to kind of walk you through things. And so the more preparation you have going into it, where you know when to get involved and when to kind of just take a step back and let kind of the people who know what they're doing do it, picking things up while you're shadowing of how to position a patient, how to get the supplies ready for a patient, blah, blah, blah. That goes a long way for the actual clerkship part of things. So that's probably one of the biggest pieces of advice I'd give you. The other thing is, you want to be balancing both your hard work, your fund of knowledge, and, just your normal social skills during these rotations. You don't want to be someone who's, trying to compensate for one of those things with the other things. No, you're not going to make a lot of friends if you're super friendly, but you're not putting in the time and the energy and doing a good job. You can work as hard as you want, but if you don't know the basics of orthopedics or surgery or whatever, you're not going to impress anyone. So it's kind of balancing all of those things. If you're a hard worker and you're really, really good knowing everything, but you're just not easy to talk to, you're not kind of gelling with people, that's also not going to be a great look for you. So it's kind of balancing all of those things. So a lot of that preparation can be done beforehand, where before you go on a rotation, have an understanding of which rotation you're going to be on. Start understanding that field. Even if it's your general surgery clerkship, know if you're going to be on the general surgery rotation, the vascular rotation, etc. And just really start kind of understanding that stuff before you go in, so that you kind of come in with some understanding of things.